Alrighty, Tara, we are here. We are in the middle of COVID-19. You are the department chair of environmental and global health. So what are the exciting things that yourself and faculty are part of with COVID-19?
Yeah, thanks, Nick. We have a lot of exciting things going on in environmental and global health. Probably the primary thing that we've been working on for the past couple weeks is standing up a research study in collaboration with the Emerging Pathogens Institute and others at the Healthcare Center
Mm-hmm.
to be able to test individuals for the coronavirus.
Yeah.
And we're really focused on testing those folks that are asymptomatic or frontline workers. So we really try to get a better understanding of the spread of the disease in the community.
Gotcha. Okay, that was my next follow-up question. So who are the individuals that you're testing? Are they students at UF? Are they UF workers, folks at Shands? Like who's your primary kind of demographic?
Yeah, all of the above, really. Because the CDC had originally mandated that the only people that could really get tested early on in this process was those that were pretty sick and
Mm-hmm.
or had traveled from countries of concern. We were actually able to test people that didn't necessarily fit that criteria.
Mm-hmm.
We're particularly interested in those folks that may be asymptomatic, but maybe have come in close contact with somebody who tested positive, or testing in communities where there are susceptible populations. So those folks
Mm-hmm.
that are 65 and older that might have underlying conditions like the folks at the village.
Right. So have there been anything, any type of like new technologies that your team has had to develop, during this pandemic, or is it just an extension of what we already do here?
Well, the brains of the operation, it's Dr. John Lednicki,
Oh,
who's
sure, yeah.
our outstanding virologist who had a test that he developed several years ago. And so we're utilizing that test in conjunction with several others, including a CDC-based test.
Mm-hmm.
And so the technology per se is not new, but we've had to really develop lots of new protocols to mobilize a big team of people quickly.
Mm-hmm. Right. So how big is that team, and what's their background and training?
Yeah, so I think the team is probably at least 30 people is my guesstimate.
Wow.
And we've really had to mobilize folks from across different laboratories. So we have several faculty from EGH that have been really working hard on this, also students and staff that have really all stepped up to volunteer their time to work on this issue with us.
Mm-hmm. And this is in the context of maintaining a typical course load, right? Because we're all streaming classes live every day and keeping up with our normal research agenda, correct?
Yeah, absolutely. So we're still teaching. We're still moving forward on that front.
Mm-hmm.
Students are still taking classes, and I've been pretty impressed. We have been doing classes, meetings, lab meetings. We had our students do their final Masters of Health Science capstone presentations yesterday, and we had
Mm-hmm.
over 35 attendees for that. So that was
Wow.
great. So people are really, on board to do what they need to do to sort of get
Right.
through this time.
So have there been students that have kind of stepped up to either volunteer outside of their normal work schedule, or are there some students where this directly fits into their course load and they're able to, kind of contribute to the cause here?
Yeah, so several folks have the certain types of expertise have stepped up to really volunteer. So
Mm-hmm.
this work is really outside of their dissertation work if they're graduate students or their staff responsibilities per se. So
Mm-hmm.
we have mobilized people that have some specialized background, which is what's required to work in
Right.
the testing lab. But everybody's just really been doing their part and really having to learn a lot of new things along the way. For example, we got a new robotic system that
Wow.
helps us process a lot of samples very rapidly. And
Mm-hmm.
so my lab manager, Sarah Basisi, had to learn how to utilize that machine in one day.
Wow.
Stepped up to the challenge and did it, and has done a lot of troubleshooting. So,
Hmm.
and it's just really worked through the protocol in a time frame that's really unprecedented to make this
Right.
work.
I mean, this is applied science 101 here, figuring it out on the fly, and in this case, it's getting more samples through the door.
Yeah, I mean, it's really an operation that typically takes about 6 months to probably set up, that we've been
Hmm.
able to stand up in just
Wow.
a few weeks' time. And that's
Hmm.
really due to the hard work and dedication of all the folks just running around the clock to make it happen because of the importance of the work.
Right. Well, we're recording this on March 31st, 2020. So what do you see? I mean, we just had the extension of the social distancing for the next month. So what do you see are going to be the biggest challenges that you and your team have to face over the next 30 days?
The hope is that some of the social distancing moves and we start seeing these spread. I'm not sure if that's going to happen, and I'm certainly not a physician. But I think some of the challenges are going to be trying to manage the testing load that we're going to have coming
Hmm.
through the door. Last week was a super busy week for us, working up all the samples from the villages, which has gotten a lot of press. Um,
Right.
and this week is not quite as busy, but next week we're already talking about other groups of folks that want to get tested, including some folks that work on the first line,
Hmm.
their workers.
So is there a resource constraint of you have a robot, you have 30 people a part of the team, and so just the demand of individuals that need testing is just going to get higher and higher with your same resources? Is that one way to look at it?
That's going to be a challenge, yeah, for sure. So right now we can run about 350 samples per day under the current
350 per day. Okay.
working conditions and the resources that we have. Um, and it would require quite a bit more resources to be able to extend that beyond that number.
Hmm.
Um, the other issue that we face, just like the healthcare professionals are dealing or struggling with the lack of PPE that's
Hmm.
available, we have some struggles on our end with laboratory-based resources that are required for us to run some of these tests. And so there are some limitations that keep us from, testing more than the 350 right now. And I think those could be potential challenges going forward for us.
Yeah, I didn't think about it in that context of we need PPE for everybody, but like what would the hierarchy be? Just kind of like thinking out loud of you need PPE for frontline staff in the ER, you need PPE for those that are testing, right? If the folks that are testing get sick, then if we think about this from a data scientist perspective, then we won't actually know the number of infections because we don't have enough testing and so on and so forth. So, um,
Yeah, so both PPE and resources like certain enzymes that are needed to run the actual experiments. So
oh,
there's
okay.
super high demand for um, laboratory-based reagents, if you
Hmm.
will, and so that is certainly a limitation for how we run the shop here.
Hmm. Yeah. So we're given 30 days, and the state of Florida doesn't have um, the mandatory, what is it, for lack of a better term, the state order to stay at home.
Mhm.
Um, does UF, are we, if we're confined to just 350 tests, well, how does that compare to the rest of Alachua County and the state of Florida?
Yeah, so we are just one of several testing labs
Okay.
and like I said, we're a research study, so we're not really a clinical testing lab. So
Okay, I
there
see.
are several other labs that are clinical labs that are CLIA
Hmm.
certified. There's one on campus through pathology. There are several others around in the county. There's the Department of Health and some other sources as well. So Alachua County does not have to rely on us solely for doing some of the testing. There's other sources for that, and I don't know what the number is collectively. What is the capacity of Alachua
Mhm.
County for testing right now. I heard the other day there might be like a drive-through testing site as well.
Mhm.
I'm just not sure. I haven't been able to keep up with it.
Right.
Um, but I do believe that Alachua County was one of the first counties to do this sort of stay-at-home order because of the increase in cases, and that's probably due to the amount of testing that is happening in Alachua County compared to some of the other counties.
Right. I see.
Yeah.
Um, yeah, so definitely have to monitor the resources over the next month, but we'll maybe kind of leave this interview here. What do you see? What does the rest of this week look like? What are you kind of looking forward to, and what's on the horizon for the rest of this week, headed into the beginning of April?
Yeah, so I think this week actually feels a little bit less hectic from the laboratory
Mhm.
standpoint. We're getting a little bit of
Right.
a breather compared to last week, getting our flow going, and so the atmosphere here has been really great. And then really looking forward to engaging more of the rest of the faculty and other things related to, our current situation, talking a little bit more to folks about potential for research and community
Hmm.
engagement related to the COVID crisis.
Yeah, that the community engagement and then future research is an interesting piece because we're ending one school year. The summer will be the summer, and then this is going to be a continued research agenda and community, piece over the next, academic year of fall 2020 going into 2021.
Yeah, it definitely will. We're going to be probably in this space for a bit of time. So
Yeah, yeah. All righty, Tara. Well, thanks for the update, and we'll talk soon.
thank you, Nick. Talk to you soon.